The primary function of the adductor muscles is to move the leg toward the body, as when you're sitting in your car and have to bring your leg in before you close the door. The adductor is attached to the pubic bone and the inside of the femur in your leg. It's divided into two separate muscles called adductor longus and adductor brevis, which just basically means one is longer than the other. Together, they work to stabilize the hip joint, and they also play a role in gait patterns and walking. When walking, the adductors pull the femur into hip extension to lift the foot, and when the foot lands, the adductors pull the femur back into hip flexion. So they're relatively small muscles, but have a pretty big responsibility. Here's an example of hip adduction. It's a small movement on its own, but it impacts stability and gait patterns in a big way. The most common area to feel pain with an adductor strain, injury, or tightness is in the groin area. And that's mostly because the adductor is attached to the pubic rami, which is a part of the pelvic bone that is closest to the groin. This is why hip stability and gait patterns would also be affected. You may also feel pain in the lower abdominals, the upper thigh, and alongside of your hip. Sometimes the pain is also referred to the glutes and the lower back. A few movement hacks I would use to treat this type of pain would be vibration, fascia release, compression, stretching, and manual resistance. We'll cover all of those in this course as well. Tight or injured adductors can impact movement patterns by causing internal rotation of the hip, which can cause misalignment of the knees and ankles as well. In this picture, you can see that clearly demonstrated in each of the joints related to the hip. This would also most likely cause pain in the lower back and impact functional movement patterns such as walking, running, climbing stairs, standing, and overall mobility. The person pictured above would have very poor body mechanics and alignment while doing squats, either at the gym or in a functional setting at home while trying to pick something up off the floor. It would also be difficult to get into or out of a car. So again, a seemingly simple injury can have a ripple effect and cause problems across the movement chain. Strong and flexible adductors are key to optimal performance for athletes and anyone who's physically active. This baseball player needs a lot of strength and stability in his hip complex in order to have the balance, flexibility, and speed required while throwing a baseball. Squatting, throwing, cycling, walking, and many other activities of daily life require the strength and stability the adductors provide to the hips. Here are two examples of an adductor stretch. The first one is a self-stretch that you can do by using a box or other elevated surface to stretch the leg out to the side and really isolate the adductors. The second is an assisted stretch. It's important and valuable to know both types of stretch so that once you have assessed and worked with your client, you can show and recommend what they can do on their own to enhance the movement method treatment plan. And now we'll show you a demonstration of an assisted stretch.
For this stretch, we are focusing on the adductors. That's the inside of the leg that attaches up into that groin. You want to make sure and keep the leg parallel to the bench as you extend it into that lateral flexion.